So I just want to start by thanking everyone for coming to attend this talk with us today. My name is Erin Stadler, and I'm originally from Fond du Lac, Wisconsin, which is about an hour and a half from where I am now at the University of Wisconsin School of Medicine and Public Health here in Madison, Wisconsin. I'm one of the new co-leaders of the SAFE chapter here at UW, along with the other student co-hosts, Rachel and Kyle. So just a little bit of background, SAFE is dedicated to eliminating the firearm violence epidemic through research, education, and evidence-based policy. We're a nonprofit organization whose members include anything from U.S. medical students to physicians, nurses, researchers, and just greater healthcare professionals as well. Many healthcare professionals, see the unique, have a unique perspective, kind of being the front line, kind of confronting firearm violence. So their frontline perspective kind of gives them a unique position to be able to advocate for changes to prevent these tragedies moving forward. So a little bit of background about SAFE, and I'll pass it over to Rachel.
Hi, my name is Rachel Bear. I'm from Merrill, Wisconsin. I always say if you take your finger and put it in the center of Wisconsin, I'm right there. I'm very excited to be co-hosting this important event for SAFE, which is an acronym for Scrubs Addressing the Firearm Epidemic. So when SAFE approached our chapter leaders to invite us to co-host this first session, it felt like the perfect time to bring our local SAFE chapter members and our several chapter faculty advisors together as its new student leaders. Clinicians are already natural advocates for their patients, and they are concerned about their patient safety, including issues related to firearms, and this concern translates into powerful advocacy. Before we begin, I'd like to ask everyone to find that mute button and keep themselves on mute to eliminate the background noise, but you can absolutely put the comments into the chat, such as to say hello or to share what institutions you are a part of. And now I'll pass it on over to Kyle.
Hi, everyone. I'm Kyle Shoger. I'm originally from Lake Geneva, Wisconsin, which is in the southeastern part of the state. And I'm also a new co-leader for the SAFE chapter at the UW SMPH. So the goal of this 6-part series over the next 12 months is to become better prepared medical students and healthcare professionals to be knowledgeable and effective advocates for evidence-based secure firearm storage and child access prevention policies. What I'm most eager to take advantage of with this opportunity is to learn with other medical students from MCW and other students and healthcare providers and faculties at this session. If you have time after this presentation and the Q&A today, which will last around to 12:45, please feel free to stay in the Zoom room. SAFE's Executive Director, Allison Volkman, and Dr. Susie McLean, our main presenter and one of SAFE's founding board members, will stay on Zoom until 1 p.m. to answer any additional questions or to help people connect. And the main portion of our event today will commence at around 12:45.
Great, thank you, student leaders. I'm Allison Volkman. I'm the Executive Director of SAFE, and I've been at SAFE since 2023. I have a background in nonprofit management and firearm injury prevention organizing, and I live and work in Madison, Wisconsin. And I'm so pleased that SAFE's first series of this kind, which is intended for medical students and healthcare providers in Wisconsin, but we do intend to invite SAFE chapters across the country to host something similar in their states. And so we're looking forward to supporting them in that effort. Although the reason this series is taking place is a tragic one after a high-profile shooting, a school shooting in Madison in December, just a month and a half ago, I'm really hopeful that as SAFE helps to educate current and future healthcare clinicians on the importance of sharing their trusted voices on firearm injury prevention policies, such as secure storage, our state has a chance of improving policies that will ultimately reduce injury and death by firearm for our communities and for your patients. I want the future children and patients of Wisconsin's medical students to not have to enter their school classrooms and think about where they will hide if there is a school shooter, which is what my own 2 high school age daughters have had to do since kindergarten, which is why I entered this work professionally in the first place. Before we share what you can expect by participating in this full series, I want to say a quick thank you to Paul Chapman. He's in our group today. He's a member of SAFE's National Advisory Board, and he's been tremendously helpful as we plan this series. And he, along with Dr. Susie McLean and several other members of SAFE's board of directors, are focused on SAFE's work in education on policy solutions to this problem. Secure storage is our current focus, and you're going to hear in a few moments why SAFE chose secure storage as our focus. I also just briefly want to acknowledge that we have Dr. Dean Winslow with us as well, and he was one of SAFE's actual founders. And so he is with us on this call as well. He's on sabbatical teaching, partial sabbatical teaching at in Oxford in England. And so he's joining us here, which is, I think, 6 or 7 hours later. So I'm glad he was able to join us as well.
Great, thanks so much for having the program, everybody. It's really looking forward to it. Thanks.
Thanks, Dean. Yeah, thank you. By participating in this series, and we're going to be recording each series. So for the people who can't join one of them, we'll make sure that we send the recording so people can get caught up. That we're hoping that people will be able to then think critically and independently about the secure storage law in their state. We want medical students, nursing students, physicians, nurses, we want them to form their own opinions on the subject and be able to articulate, should our state secure storage related law be changed? If so, why? And if so, how? We aim to help you become better prepared medical and nursing students and healthcare professionals to become more knowledgeable and effective advocates for evidence-based secure firearm storage and child access prevention policies. So at the second session, which we'll send you a link to register in a little bit, it's going to take place on March 28th at noon. We'll provide an education on the evidence that secure storage laws work, followed by a discussion of how to use that in messaging. And now I'll pass it back to Erin.
Yeah, thanks so much, Allison. To kind of follow up on that second session, there will then be a third session in May that will include coaching on the power of storytelling, anecdotes, as well as relationship building and letter writing to legislative aides, as well as perseverance throughout advocacy work in general. We'll also give an update on the brand new Wisconsin State Office of Violence Prevention. On June 3rd, Dr. Day at the Capitol here in Madison will take place, and we are putting a link in the chat where you can register to practice what you've learned. The event is not put on by SAFE, but it is a really great opportunity to practice advocacy skills.
In session 4 will be in August, and that will be more of an educational and feedback session on writing follow-up letters to legislators. We will discuss follow-up responses from the letters and calls, and June's Dr. Day at the Capitol. This will include education and research on the Wisconsin legislators who are likely to be supportive and how to engage them. And then session 5 will be in November, and will be an educational and coaching meeting on how to reach out to other Wisconsin medical groups and organizations to join the effort.
And lastly, the session 6 will be in February of 2026. SAFE will reassess where we are and work with us, the medical students, and those who participate in the series on next steps. We'll discuss what to do if the Wisconsin state efforts to improve secure firearm storage laws are going nowhere. We'll talk with you about working with the city councils and consider working with public education through the schools. And now for the next 20 minutes or so, we'll hear from Dr. Susie McLean. Susie is one of SAFE's founding board members. Her reasons for doing this work are compelling, so I'll ask that she introduce herself and how she came to be with us today in Wisconsin from California.
Thank you so much, Kyle. And I'm so happy to be here to talk with all of you about something I actually care a lot about. And I will just give a few words about my background before I launch my slides. So I'm a primary care internal medicine doctor. I've practiced for 30 years in Santa Clara, California. And when I retired in 2018, I decided I wanted to devote my volunteer efforts in the emerging field of gun violence prevention. And I was especially interested, and am still especially interested, in a public health approach to preventing firearm harm. So I started volunteering with SAFE in 2018. I'm on the board of directors. And related to our subject today, I was working with an alliance of other advocates in California to improve California's firearm storage laws. And I'm very happy to report that after 2 years of efforts, we had the improved secure firearm storage laws passed in 2024. So that was just a great feeling. So, when the shooting happened in Madison in December, I don't know, it felt like it hit close to home for me because we have some core leadership for SAFE in Madison, and we have our chapter there. And so because of my background in firearm storage, and I heard the shooter was 15 years old, I looked up what's Wisconsin's firearm storage law, and honestly, my jaw dropped. I thought, oh my goodness, this needs to change. This is not a law that is focused on prevention. And so I'm hoping today that some of you will decide to lean into this effort in your state and decide to use your voice to make change happen. What I'm hoping to do is to actually give you the lecture that I wish someone had given me when I was starting out in this, and give you kind of a framework, a lay of the land, if you will, about what's going on in the field of firearm storage laws, and ideas about what can be changed. So I'm going to hopefully share my screen with, does that look? Is that looking good? Thumbs up. Okay. So here we are. So we're going to talk about secure firearm storage. This is what I hope to cover today. I mentioned the landscape. So we're going to go over the landscape of federal law, state law. I'm going to give you a framework of how to conceptualize the law in the next 2 bullets. And these 2 terms, required secure storage law and child access prevention law, also called CAP laws. I really want you to understand at the end of the lecture, understand what the difference is between these 2 terms and where there are strengths and weaknesses in them. I don't want to say you have to master them, but almost, because I think to talk about this subject, you need to understand those concepts. We're going to cover Ethan's Law, and some of you may have heard of that. And then we're going to dig into what's actually in place now in Wisconsin. And then we're going to end talking about Massachusetts. And they have what I think is excellent program, which will give us some hope about how things can be better. So I'm going to run through the talk. I'm not going to look at the chat during the talk, but if you have thoughts that you want to put in there or questions, go ahead and put them in. At the end, we'll pull them all out and go through them. So here we go. So starting with federal laws. First main fact, there are no federal laws about firearm storage. There is a federal law that requires dealers to provide buyers a handgun who buy a handgun, a secure storage device, but that does not require that the purchaser use the device. Ethan's Law, I'm going to go over that more later, but Ethan's Law was introduced as a possible federal law. It was introduced in Congress in 3 different years, but it never made it through Congress. It died. It either wasn't voted on or voted on one house and not passed on to the second. So as a result, we have no federal law about firearm storage. State laws, a little over half of the states have either a CAP law and or a required secure storage law. So think about that, about half the states, meaning the other half have no law. And now I'm going to go over 2 excellent resources. And all of you are going to have a copy of the slides. So you're going to have a copy of these links. And I think Allison is going to put the links in the chat now in case you want to look around on your own. But I am hopefully going to open these up just to show you how I use them, so you can see their benefit. I'm not going to try to open the Giffords thing because we'll get into the same ballgame. But please go ahead and open it up on your own. And it's a beautiful site. It's my favorite site in Giffords that says it has a summary of the state laws. And if you scroll down, you will see all the different laws like concealed carry and background checks. And there is a link for, it'll say child access prevention and secure storage. And if you click on that, it has a beautiful summary of the law. And that's exactly what I went to when I was hearing the news. The news was still going on, the 15-year-old shooter in Madison. And I thought, what are the laws in Wisconsin? And this is just a great source. So I'm going to kind of keep going, and I guess I won't open them, but we'll share them with you in the chat, the links. Okay, so required secure storage law. I mentioned to you that I think understanding this term is really important for the framework of understanding what's going on in this field. So the operative word is required. It requires firearm owners or possessors to securely store firearms at all times when they are not under their immediate control. It usually defines secure storage as using a locking device or a safe. It's very straightforward. There are no what I call conditions. It's easy to explain to the public or to your patients. And currently, 5 states have a required secure storage law in place: Massachusetts, Rhode Island, Connecticut, Oregon. And I'm proud to say California, because this is exactly what I had been advocating for a couple of years. California had a cap law in place, which was a pretty good cap law, but we wanted to have the required secure storage law in addition. So I'll let you read through this at your leisure. It's basically sample language of a required secure storage law. You can see how it is framed in sort of a little more legal language, and goes through the concept. So child access prevention law. This is the other type of law that the majority of states who have a law have this type of law. And I think you'll see, compared to the required secure storage law, it's not as straightforward, even though the intention is to prevent child access to firearms. There are a lot of conditions put on it where it doesn't apply. And it doesn't usually state explicitly how guns should be stored. Rather, it focuses a little more on what circumstances the owner will be held liable for a child's access. So it's not really written from a real true prevention aspect. It's more about liability and punishment. So 21 states have this type of law, including Wisconsin. And so let's go through some of the conditions and variables. And each state will have a different type of set of conditions on it. So one is the age of the child. So some define the age as less than 14, Wisconsin, for example. Others less than 18. Some liability is only applied if the firearm is loaded. Sometimes it's if the child is likely to gain access to the firearm or actually accesses it. And then in some cases, liability only applies if the child takes the firearm out in public, and sometimes requires the child to actually injure someone with the firearm for it to apply. So you can see there are a lot of conditions. It can be a little confusing to explain to the public. So let's go through Ethan's law now. Ethan's law is a cap law. It was named after a 15-year-old named Ethan Song from Connecticut, who was accidentally shot and killed when he and a friend were playing with a pistol in the friend's home, and the father had some pistols in his bedroom closet. So at the time, Connecticut had a cap law that did make it a crime to store a loaded firearm where a child might get access. So there was a law in place, but it had these conditions on it. And in the particular case, the 3 firearms were unloaded, but they were stored in a box inside a Tupperware container with locking devices in place, but the keys and the ammunition were in the same container. So this particular circumstance did not meet the requirements for that cap law. So the owner was not charged. The parents were devastated, not only at the loss of their son, but at the lack of accountability. And they became advocates for improving secure storage laws. So Ethan's law was passed the next year, and it was passed in Connecticut. It improved Connecticut's cap law, stating that firearms must be stored securely whenever a child under age 18 might have access. So it took away the requirement that the firearm be loaded. It also changed the age from 16 to 18. So as I mentioned before, Ethan's law has been suggested or put forward to the US Congress to create a federal law similar to that, but it has never been moved forward through Congress and is not approved at a federal level. So in 2023, Connecticut decided to expand their firearms storage law to include a required secure storage element, requiring firearm owners to securely store their firearms whenever the firearm's not in their immediate control. So, and that's just what California did after them in 2024. So you can see they moved from a kind of a weaker cap law to Ethan's law, which is a reasonably good cap law. And now, in addition, they have the required secure storage law on top of the cap law. So let's look at Wisconsin's laws. Unfortunately, my opinion is that they're kind of a textbook, if you will, of a weak cap law. It only applies to children under age 14. The firearm must be loaded, and the child must access the firearm and either take it to a public place or shoot someone and cause harm. So I think it was when I read that last piece that my jaw dropped when I was reading Wisconsin's law. I said, wait, what? Where's the prevention in this? This is not going to prevent harm if you wait till harm is already done. So, furthermore, it only applies if the owner reasonably believes a child might be present, and there's no requirement or guidance to store firearms in a particular way. So I'm not going to click on this, but it's a link that takes you to the actual law if you want to look it up. If you decide to lean into this and you want to work on improving Wisconsin's law, you'll find the law right there. So we're going to end the content talking about Massachusetts, which has had a required secure storage law for 10 years. And I've been so impressed. They include it in their public messaging. They have a brochure that's published jointly by the Massachusetts Medical Society and the State Attorney General, titled Gun Safety and Your Health. And one of the quotes in there, I think it's so great. They just say, safe gun storage is critical to the health and safety of you and your loved ones. It's also the law. So I find that statement just so, it's so clean, so easy to explain to public and to your patients. And if you click on the link, you will see the brochure. So you'll see what I'm talking about as a great example of something that can be used with public health messaging. So this is my last slide, just kind of summarizing what we went through. We talked about federal laws. There are no federal laws. State laws that a little over half the states have some kind of law, but they vary widely. Required secure storage laws are ideal, and 5 states have that. Child access prevention laws vary from quite weak, unfortunately, to reasonable, such as Ethan's law. Wisconsin, we went through the weaknesses in the law in your state, and then Massachusetts as a model for public health messaging. So I think that's the end of my slides, and we can stop sharing. Is my screen gone?
No, we can still see your screen.
Okay.
They hit.
I have to hit stop sharing.
There you go. Should be able to click on stop sharing. I'm not sure if I can stop for you. Sorry.
Just stop it. I don't know. I'm looking for the button and I'm not finding it. Yeah.
I'm actually not able to stop sharing your screens. I'm sorry, Susie.
Okay.
Keep searching, and I think we'll just have, as you're looking for that, so that we can have see our faces. We'll have Erin.
Yeah, I can. Well, thank you so much, Dr. McLean. That was really helpful to get a good overview of kind of where things stand. And I hope everyone else found it helpful to kind of dig in a little deeper on Wisconsin's CAP laws and feel a little more informed after that presentation. In the second session on March 28th at noon, we'll provide an education on the evidence that secure storage laws work effectively, followed by a discussion of how to effectively use that messaging. The registration for that is in the chat, and I will now pass it over to Rachel.
Thank you, Erin. And again, thank you, Dr. McLean. This is difficult work. It doesn't seem like it's something we should have to do. Some of us on this call advocate for their patients and their families every day. Some of us are just learning how to do that in medical school, like myself. It's important work, though, and we appreciate you all for showing up today. We'll be resharing the resources with you after the event, including the slides, and I'll pass it on over to Kyle.
Yeah, and if you have any questions you would like to ask, you can feel free to write the questions in the chat. Dr. McLean and Allison will get to as many of them as possible in the next 10 minutes. And then after that, they'll both stay on the Zoom until 1 p.m. Central Time to confirm, to further connect with those who aren't heading to the class. Because
In the absence of any questions in the chat, because I don't see any, then people just feel free to take yourself off mute and I almost said fire away. That wouldn't be appropriate. And ask your question. We're happy to help answer them or provide any clarifying information. Yeah, Dr. Stiles, good to see you.
Hi, it's Melissa. Susie, thank you so much. And thanks, Kyle, Erin, and Rachel. Really nice presentation. I just had a couple questions. When looking at the level of offense, as I noticed, Wisconsin is a misdemeanor. Is that similar, or is it, depending on the degree? But that caught my eye right away that it was just a straight misdemeanor.
Yeah, every state has its own way of laying out the penalties. It gets very complicated. There are states that have felonies. And yeah, but a lot of times they're progressive. Like if the child could access it, for example, in California, if the child could access it, it's one penalty. If the child does access it, it's another level of penalty. If the child accesses it the firearm and hurts somebody, then it escalates. So it might start as a misdemeanor and end up as a felony as you move to more egregious offenses.
So in the incident that happened in Wisconsin in December, the way that the child access prevention law is written now, there was no law broken until that child brought the firearm and injured someone.
Well, she's above the age. It's 14 or below,
Right.
and she's 15.
And she's 15.
So that
Yeah.
well, I mean, if the law is followed as it's written, it doesn't seem that there's liability. They might find a way to have some liability, but yeah.
Yeah. So there is no prevention. That law as written does not prevent the crime from taking place, or at least from someone being liable to being responsible for that, such as the parents. Yeah. What other questions do people have, either about secure storage or the series that we're hosting, or about SAFE?
Well, I had another question, if it's okay. In fact, Susie, just in your experience, what can you describe the pushback that you got? You know, what barriers did you overcome in California to get it passed? I just can imagine in so with Wisconsin, you know, there's a big one, you know, hunting climate here, and children at the age of 12 can have a gun if they're with their parent. So, I mean, it's a very, you know, the gun culture is very deep here. So I had, and then also the question that often comes up is, well, I have my gun for protection, so I need to have it loaded and accessible. So I was just interested to see what kind of barriers you came up against.
I think the idea of having a firearm for protection is common. You know, studies say that's the most common reason people are buying firearms these days across the country. But the argument that you can't use a firearm for protection if it's locked has kind of gone away now that locks are available that are very easy open. I mean, you can open it quicker than you can call 911. You know, it's either a fingerprint or a quick dial if you have certain types of locks. So that argument has kind of fallen away. You know, interestingly, in the legislature, one of the barriers was not, you know, it was a time where there was concern that we were having so many laws and affecting disadvantaged communities more, and we didn't want to have more penalties for things. Anyway, we overcame that because you can have the law and not have a severe penalty if no harm is done. And as I said, they have escalating penalties where it becomes, you know, a felony if a child accesses a gun and does harm. But if you simply didn't have it locked and no harm was done, a child didn't even access it, I think the penalty is very minimal. So we had to sort of address the penalties and make them seem fair, I guess.
Thanks.
I'm hopeful that there's less barriers. You know, there seems to be a little momentum. I heard that New York State is working now on a required secure storage law. And, you know, one thing I wanted to sort of make clear, you know, you're starting where you are in Wisconsin, and sometimes it's steps. You know, you might not get everything you want or everything that's ideal in the first step. Maybe you will, but maybe it's just improving what you have. Even, I mean, even if it's just changing the age would just be like one thing that seems not as difficult. But I mean, I would like to have it changed to be super safe, but you can be realistic and go stepwise. And
Susie,
what-
one of the questions that we have is, or requests, is to please give some examples of why there is resistance regarding child firearm safety.
I think the culture is a bit of don't tell me what to do. I think I know how to do things safely. And there's kind of a misunderstanding that having your firearms in your closet is secure. So I think it's a bit of I don't know, is it the libertarian philosophy of just, they just don't want more laws telling them what to do with their firearms. I think that's somewhat of the resistance.
Is it okay if I jump in real quickly, Susie?
Yeah,
So,
please.
again, I'm not a gun owner, but I've, obviously, used weapons regularly in the military. But I think also what a lot of people say that have handguns, which are predominantly owned for, quote, protection, even though statistically, having a gun in the house doesn't make you safer. And so a lot of handgun owners basically say, I want to keep my gun loaded and right by my bedside, for example, in case an intruder comes in. So there's a lot of that. And that's one reason I think that the trigger locks aren't as popular, because again, they take a little bit of fiddling, to get them off. And then you've got to, load your magazine that hopefully you've stored separately. Whereas one thing that, even though they're a lot more expensive, is, having biometric locks and actually safes, even though still ideally you should store, the weapon unloaded and, and the ammunition separately. I think still my, opinion is that it, even having a loaded gun stored securely in a biometric safe, would be a lot safer than not, storing it safely at all. So, which is what now happens most of the time.
I have also heard that some firearm owners who have gone to great lengths to educate their young children about firearms believe that the education they've given is enough to keep them from harm, but they don't fully understand some of the risks adolescents, for example, have with suicide risk and so forth with access. So some of it is that kind of over emphasizing the education that they've given within their own family about firearm safety and thinking that that's adequate. Anyway, you were going to say, is there another question, Allison?
No, it wasn't a question. It was more of just saying that SAFE is going to be sharing soon some examples of very short videos that is a voiceover of one of our board members who's in Wisconsin, Dr. James Bigham, of sort of explaining like how one could respond to their patient who uses that barrier, indicating, well, I need to have it by the bedside, I need to have it loaded. And then there's a very short video that shows a firearm securely stored and how long it takes to get access and to load it. And it's about 3 seconds long. So the risk outweighs the convenience of having your firearm stored next to you, because God forbid someone else gets their hands on that firearm before you have access to get to it yourself. So we're going to be sharing that soon in the coming month, where we have this series of videos that physicians and medical students could watch and feel more empowered to explain to their patients about how long it actually takes to get access, and which then I think lends credibility to the person who's doing the educating to the physician. We're finding that many physicians and medical students, they didn't grow up in a house with firearms. And so there's a lack of confidence or a lack of knowing if I'm saying the right words to talk about this with their patients. So we're hoping that those videos will give some more confidence to people.
I have a quick question. So about the shooting that happened in Oxford, Michigan, I remember that was kind of like a landmark case because the parents were actually held accountable, but I noticed that they weren't listed as one of the states, one of the 5 states with the pretty reasonable laws. So can you explain kind of if Michigan has tried then since that case to implement laws, or just thinking it's a little similar to Wisconsin culturally and geographic wise?
No, I didn't research what's going on. We should look up what the laws are in Michigan. It's easy to look it up. I've given you the resources. So yeah, to see what what the law is there and how that fell out for the parents. That was a case where they were actually they gave the child a gun, right? And the child had some mental health challenges and so forth. So there's another level of discussion that I didn't cover because it's not so much about storage, but it's called recklessness with firearms, and that may have had a role with Michigan. It's where you give a firearm to someone recklessly.
Right,
So,
someone who is not well or not or young or showing signs of mental
Yeah.
health. Paul Chapman, you raised your hand. Do you have a comment or question?
Well, just thank you for the question about Oxford. It's such a complicated moment. But I've read the charging documents, and one of the interesting things in the 34 charges is that the state's AG brought the charge of domestic terrorism in charging Ethan Crumbley. And the reason she did that was that she was well aware of the devastation that the attack had, certainly on the 4 students who were killed, all those wounded, their families, all the employees, all the students, all the members in the community. And it's a legal point that's now being discussed by AGs in other states, recognizing that hundreds of thousands of students and staff in schools in our country have experienced school shootings with devastating consequences, both in the short term and then over a lifetime. There was a significant report that was commissioned in Michigan analyzing that particular case. And it's about 550 pages. But if you're interested in a turning point moment, it's definitely worth reading. And Allison, I could send that link to you.
That'd be great. Thank you so much. I want to make sure that people feel that they can stay on until the top of the hour if they have other questions, but I also just wanted to acknowledge and thank you to Erin, Rachel, and Kyle, and of course to Dr. Susie McLean for being on this call and being willing to have at it with us and have this 6-part series. And thank you to everyone who's on this call or who's watching this recording after the fact. There's great questions that were asked. There's great links that were shared. We will share the entire slide deck with you via email later today or tomorrow. And just being ready to learn about this topic. As Rachel said, it's hard work and we shouldn't have to do this, but thank you for being here to do this. So with that, we're happy to stay on, but I'm going to end the recording and wish you all well and to stay warm. And feel free to drop off the call when you need to leave.
Thank you all for showing up.
Recording button. Yeah, thank you all.
Thank you.